essence of this program every Thursday is to help you, to help someone to stay alive. So I welcome you once again to the issues. My name is Victor Chibong. It promises to be an interesting time. Checking my time right now, it is just about 3 minutes past 11. So that means that for the next 48 minutes or thereabouts, we are going to be having this educational process that has to do with health. Of course, coming from Ikorodu General Hospital. I'll go on a very short break. When I return, I'll be introducing my guests. She's sitting right here with me in the live studio, and then we're going to be having a conversation. But before I go, let me just let you know that today we're talking about liquid burns. You might not understand, I may not understand. That is how we have our doctor in the house to break it down bit by bit. Don't go nowhere. Stay there now. Yes, I did say that we will be talking about liquid burns, and that is something I am already asking myself, what is it all about? So my guest today in the studio is a plastic surgeon, and she's none other than Dr. Khadijat Aliyu from the General Hospital Ikorodu. She's going to be talking to us about liquid burns, what part of the body, which area of the body this takes place or this can be done, and all of that. So I just want to implore you that you sit back and enjoy this session of medical education, because it is very, very important. Good morning, Dr. Khadijat.
Good morning, presenter, and good morning, our dear listeners.
Yes, thank you very much for coming. Let me wish you compliment of the season.
Thank you so much. Wish you the same.
All right. So, as you already know, I'm standing on behalf of my colleague. So we're going to be having this conversation for the next few minutes and see how it goes. I think the first thing that people would want to know about is what is liquid burns. Or would you say we start from there, or you have an idea of where you would rather want to start from before we come down to liquid burns properly?
Yes, thank you very much.
Okay.
First, I want to introduce what burns are generally.
All right.
So, burns are one of the most harmful physical and psychological traumas that can befall a man. They usually happen unexpectedly, and they have a potential to cause death, lifelong disfigurement, and dysfunction. It has been documented that depression sets in patients who have been hospitalized for burns within a month of admission. And up to 2 years after the injury, 43% of them are still depressed. And this is usually commoner in women than men. So the skin is said to be the largest organ in the body, and this functions as a first-line defense against invasion of foreign bodies and organisms. So a burn injury is that injury to the skin or other organic tissue to the body that is caused primarily by heat, or can be due to radiation, radioactivity, electricity, friction, or contact with chemicals. In fact, it has been documented in literature that there are over 22 causes, various causes of burns. But the ones I've listed earlier are the commonest, the commoner ones. But the commonest one is thermal injury, and this accounts for 90% of all burn injuries. So the severity of burn injuries is usually related to the temperature of the agent and the duration of application of the heat. So thermal burn can be classified into wet or dry burns. So the wet burns is where the scald injury comes in. So it's a form of wet burn, and this is usually as a result of spillage of hot liquid, steam, or and they account for 70% of burn injuries that occur in children and in the elderly. So examples of the other type of burn, which is a dry thermal injury, these are typically caused by flame, and then also by direct contact or exposure to radiant heat. So scald injuries occur when the skin is exposed to hot fluid or steam, and this results in damage to the tissues, the skin, and sometimes the underlying tissue. So why this topic? So the Nigerian Burn Injury Society, which is a body that comprises of all healthcare professionals that take care of burn injuries. This ranges from plastic surgeons, nurses, physiotherapists, and even the nutritionists. So this society, annually, they have a campaign on burn awareness, usually around this time of the year. So this year's theme is based on scald injury, and we want to create awareness and about it and how to prevent it. The reason is that this is a type of burn that is really common and is highly preventable. if we are able to, it can be averted by some precautionary measures that we take in our homes.
Okay, so I'm seeing some, just as you said, there are various degrees of burns. First degree burns, second degree burns, and then third degree burns.
Okay.
Please, can you just shed a bit of light in each of these degrees so that our listeners will have a thorough idea of what we are saying? I won't lie to you, listening to you, giving us all of these facts as regards liquid burns, it still seems a little bit strange to me, but I believe, with you in here, you're going to break it down bit by bit for our consumption.
Okay. So traditionally, the severity of burns is classified based on the extent and the depth. So, and that's where the degree comes in. And this is actually a traditional mode of classifying burns. Currently, we don't really use that anymore.
Okay.
So, the first degree that we used to know in those days is the very superficial burn. In this kind of burn, there is no obvious injury to the skin, but there can be redness of the skin. So this is the kind of injury that is caused by sunburn.
Okay, is this common to dark-skinned people?
It's
when
common.
You say redness?
Yeah, well, redness might not be so obvious in dark skin, but it occurs. I can assure you that it occurs. Right. But it's more prominent in light-skinned people or the Caucasians, the white people.
That's true.
Okay. So the second degree burn is the kind of burn where we have a little bit of skin damage and which we have blisters. When you begin to see blisters following burn injury, that is the type we classify as second degree burns. So the third degree burns, and that second degree burn is actually very painful because it's really superficial. It affects the superficial layers of the skin. So the third degree burns is the one that affects the deeper layers of the skin. And in this case, it's not as painful as the second degree burns, and they have blisters too, but most of the blisters will have ruptured. So the fourth degree burns is the most severe of them all. This is the kind of burns that destroy all the layers of the skin and can even involve the underlying tissues. It can involve the fat, it can involve the muscle, and sometimes can even involve the bone. So it can be that deep. So that is the basic classification.
Now let's deal with this third degree burn. Now,
yes.
When you said it can even affect the bones, it sounds scary.
Yes.
How do you mean?
Well, this is kind of burn that people experience when they are trapped in a place. Usually occurs as a result of maybe fire outbreak, when people are trapped in a place and they continue to burn and there is no rescue. Rescue does not come on time. Help doesn't come on time. So this is when somebody actually burns to death or a part of the body is burnt. That the only treatment that we offer in that situation is to actually remove that part of the body. So yes, if the person is not rescued on time, it can actually be that deep. And also electrical burns can result in this kind of fourth degree burns.
What about building collapse?
Well, building collapse will cause a physical trauma unless there's a fire outbreak in that place. At the same time, that can also lead to burns.
Okay.
Yeah.
All right. Thank you very much. We're talking health issues, and of course, Dr. Khadijat Aliyu, our plastic surgeon, is giving us this information as regards the various degrees of burns. And don't forget, the topic is liquid burns. Now, you did mention that there's a sensitization program, rather,
yes,
that is ongoing currently.
Yes.
And I think that is the essence you're here.
Yes.
So that people within Ikorodu, whichever local government, so long as you're within Ikorodu, can tap into this program. Please take us through on that.
So, like I said, the Nigerian Burn Injury Society is a society that comprises of all healthcare professionals that take care of burn injuries. So they usually campaign annually around this time of the year. So the theme is about scalp burn. So I just want to give you some facts about scalp injury. So
scalp injury.
That is liquid burn.
You see, when you medical people, like when we go to the hospital, okay, fine. I was at the hospital for more than a month, and I came back. Sometimes when I see the way you write some things, like prescriptions or drugs, I'll be asking myself, is this shorthand? No, it is not shorthand. So when you use some terms, please, for the benefit of laymen like us, let's flow very well.
Okay. So the liquid burn we are referring to is the scalp injury.
Scalp injury.
Scalp injury is liquid burn.
Okay.
Okay. So this injury can happen to anyone and can happen at any time. Young children, but those that are particularly at risk are the young children, the elderly, and the disabled people. Most scalp injuries happen in the home, and usually in connection to preparing of meals and serving of hot food or beverages. And also can happen in our bathrooms, or when one is exposed to hot tap water or hot bathtubs. So behavioral and environmental measures are needed to protect the vulnerable population. So other risk factors that have been identified are people who live in overcrowded environments. So this increases the risk of scald injury. Also, poverty. Low socioeconomic status is also a high risk factor. We will see why shortly. Then also, it has been noted that if people in the areas where children lack a safe playing environment, this can also increase the risk of scald injury. And also, if the mother of the child is single, a single mother, young and uneducated, there's a high chance that such a child can suffer from burn injury. So the prevention of scald injury is also always preferable to treatment, as treatment is better and cheaper than cure, and can be accomplished by a change in behavior. So how can we prevent scald injury? First thing is, like we said, it usually occurs in our homes, mostly in the kitchen and the bathroom. So how can we prevent scald injury? In the kitchen, we must keep children out of the kitchen. We must keep children out of the kitchen. But this might not be possible if a mother is alone with her child and she has to cook. She doesn't have a choice than to probably bring the child into the kitchen.
The child that needs attention will
yes,
always cry to the mother.
Exactly. So in this case, we can bring the child into the kitchen if the kitchen is spacious enough, and we have like a high chair or a playpen where you can keep the child away from the cooking area. Walkers are extremely dangerous and they should not be allowed in the kitchen. So then another important thing is to avoid floor level cooking. So what's floor level cooking? And this is a situation whereby we cook with people in the rural areas now. People cook with firewood or kerosene stove at the floor level. You know, this becomes very easily accessible to the child. If a child finds his way to the kitchen, can easily pull down
that curiosity.
Yes,
What's
they are curious
there?
at that age, so they can easily pull down a hot pot of cooking soup or hot water, and such fluid will spill on the child.
Doctor, I'm sorry to interject. You know, while you were making mention of this, children thing going into the kitchen.
Yeah.
I have two experience. I hope if you don't mind, I can share my experience.
Please
Okay.
go ahead.
So I was so engrossed with the aroma of the food. It was my big auntie that was preparing it. And living in the face where I slept, we normally have this long corridor that you walk through. So I was, steadily walking down towards the kitchen to see what is cooking, because the aroma was enticing and inviting with the pot of what she has just prepared. I bashed into her. Instead of barging into her body to body, it was the pot she was holding that I bashed into, and everything poured on my chest.
Wow.
That was one. Secondly, my brothers will never forgive me for this. They still keep calling me names on that. My mom was frying plantain, delicious plantain, and what was it plantain? It was fish. And in my head, I was like, wow, I need to eat this fish because I was so hungry. I still remember very well. It was on a Saturday morning. And doctor, guess what I did? I didn't use a fork. I didn't use a spoon. I didn't use anything. I didn't even use my finger. I directly dipped my mouth into the frying pan. I thought maybe my teeth would be the first thing to take the fish.
Wow.
What I had was free.
Wow. Amazing.
And it was when you were saying all these children and all of that, my mind flashed back to that. And we can imagine the curiosity of so many children who perhaps for them seeking attention, some because mommy is cooking something delicious, I need to be around and eat, and this occurs.
And I tell you, that's the story with a lot of patients that come to the hospital. That's usually the history. Is either an adult is carrying a hot fluid and a child runs into the adult and the fluid spills on the child. So that happens a lot. It's usually the story amongst most patients that present to the hospital. Yeah.
Wow. Okay, this is getting more interesting. All right, so this sensitization program is started somewhere around this year. It has started rather somewhere around this year, or usually this year in November, December.
Exactly.
They push the program.
Yes.
For the people who are not aware of this, who are probably hearing this for the very first time, how can they key into what is happening at the moment?
Well, that is why we're here. It's basically, essentially an awareness campaign.
Right.
So which is why we are creating this awareness. That's why we have come here to talk about it, so that people can know about it and even know what to do if such injuries do occur. Okay, so I think I'll just go back to the preventive measures I was talking about
Okay,
earlier.
please do. Please do.
Alright. So, like floor level cooking, which involves cooking with firewood or kerosene stove on the floor. So it's recommended that we cook on a platform. Maybe you put a stove on a table or on a countertop where a child cannot easily reach. So and this is preferable to prevent exposure to these children to hot fluid. And then also we should ensure that when we are cooking on this on these cookers, the countertops, we should make sure that the handle of our pans and pots are turned backward rather than towards the edge of the stove. Because if a child finds his way to the kitchen, he can easily pull and grab whatever is on the stove, not knowing what is inside, and this can result in spillage. So we should try and make sure that the handle of the pan are turned backward, away from the edge of the stove. So another factor is to avoid wearing loose garments while cooking. I know that for religious or cultural reasons, some people wear flowing garments, loose garments, but this should be avoided in the kitchen, because one, it can catch fire, and also it can also knock off a pot or a pan containing hot fluid from the fire. So we should try and wear fitted garments, or short sleeve garments preferably, when cooking in the kitchen.
Okay.
And then when we are bringing down hot pots or pans from the cooker, we should make sure that we use a pot holder or mitts to hold hot pots or pans. Then another important thing is that sometimes the handle of the appliances or pots become loose, become weary. So we should make sure that we check to guarantee their security each time. Because imagine one is carrying a hot pot of oil, you're trying to bring it down from this hot stove, and the pan turned on itself. So it's going to result in spillage of oil that can cause injury. So we should make sure that those handles are secure at every given time. So then, regarding the floor of the kitchen should be non-slip. So we should avoid the use of smooth tiles on the kitchen. So or rugs, so that it would not allow for spill. It will not be slippery as to lead to fall that can cause spillage of hot liquids. Then coming to the dining area now, the kitchen and the dining area are very close.
Yes.
So in the dining area, we should avoid the use of tablecloths. We should rather use table mats. Why? Because if you have little children in the house who are just trying to walk, like toddlers, they want to grab everything in their way. So imagine you had a hot cup of tea or soup on the table, and the child grabs on the tablecloth and pulls it towards himself. This will result in spillage of such content on the child. So we should avoid tablecloths in the dining area. Also, when we place hot food on the dining table, we should make sure that it's far away from the edge of the table, at least about 10 inches from the edge. We should try and place it at the center of the table, such that no child, at least a child of that age, would not be able to reach the hot fluid. Any child that can reach a hot plate at the center of the table is probably wise enough and will not be playing with such. Okay. So then we should avoid carrying hot fluid around the house. So I know that in a lot of homes, people don't have water heater in their bathrooms, so they have to heat up their water in the kitchen and transport it to the bathroom. So if we must do this, we should make sure that we get some cold water in a bucket. Take the bucket to the kitchen, pour the hot water into the cold water, and now transport it that way. And also, it's safer that way, because you never know when you run into a child. Yes, in the house. Then also, some people have blinds within the house, like curtains separating rooms. This is actually a very important cause of burns. An adult is carrying a kettle of hot water, going to the bathroom to pour the water for the child to bathe, and the child runs into the adult behind the curtain, because you don't know who is on the other side of the curtain. So if you can avoid having curtains within the house, it's preferable. But if you cannot, please do not transport hot liquid around the house. Rather, fetch some cold water, mix the water thoroughly before transporting it to the bathroom. Okay. So also, when you are carrying a child, please do not carry hot liquid at the same time, because you know that a child will want to rapid motions of grabbing and reaching. Within seconds, they can just grab the cup you're holding, and that can lead to spillage. So we should avoid carrying a child when we have a hot cup of tea, or we're carrying any hot liquid. So coming to the bathroom area now, if you're the type that uses a hot tub in your house, you have a water heater, it's important that you run the cold water first, then run the hot water. Then make sure that you do not leave the bathroom until you have mixed the water, and to be sure that it's the right temperature. You can check with your fingertips or the elbow, and if you have a thermometer, it's even preferable. The ideal temperature for bath water is between 37 to 38 degrees Celsius. It should not be more than that, because it can cause injury to the skin. Then also always make sure that the door of the bathroom is closed to prevent access, or to prevent children from having access to that area unattended, because you never know what they'll be doing in there.
I'm tempted. I'm tempted to stay quiet on it, but I said I must say it.
Okay.
You know, sincerely, when it comes to that issue of water heater, I've heard stories. I've heard stories of it busting, and I'll be like, wow. So a lot of times when I go to maybe hotels that they have it and I see it, I'll just tell the water heater, please, for the duration of days that I'm going to be here, stay your stay, I stay my stay. Let's respect ourselves.
Yes.
So I'm happy you're saying this now, because, you know, just like when you talked about activities in the kitchen, especially in that angle of you carrying hot water to the bathroom if you want to bathe warm water, a lot of homes make these mistakes.
Yes.
A lot of homes, and I'm happy you're saying this now. The same thing goes to the dining table, where you use tablecloths instead of using table mats. So I'm happy you're bringing this, you know, to our listeners. And if you're listening, it's important you take note of all of this and then you put it to action. She is still talking about so many things, because these are complaints that they get on daily basis, you know, at their workplace, which is the hospital. Parents bringing their children home and they cry that help me, help my child, and all of this. And most times this is due to carelessness or negligence, or not even adhering to things like this at the end of the day. We're still listening to you, please, when it comes to the bathroom.
Okay. So also we know that one of the risk groups that we mentioned earlier is the disabled. So for the disabled, it will be important to install grab bars or shower seats, so that such patients can have something to hold on to when they are going into the bathroom. Or we can have shower seats where they can sit down and take a bath. Or we should also make sure that the floor in the bathroom is also non-slip. You don't want to use smooth tiles in the bathroom that can result in fall and can cause burn injuries. Then you know that in the elderly, they have some medical conditions sometimes that makes them not to be able to have sensation on their hands, so they may not be able to tell the exact temperature of water. For medical reasons, sometimes when they have diabetes, they may lose sensation on the tip of their finger. So for such patients, it's recommended that another person in the house should actually help them to check the temperature of the water before they use it. And we know that
for the elderly, even when they dip their hands inside,
they may not, because of because of nerve.
You don't feel anything.
Yes, because of the damage to the nerve ending as a result of diabetes that occur in these people. They may not know. So in fact, when some of these elderly people go to take care of their grandchildren, it's important that someone else in the house check the temperature of the water before they use that water to bathe the baby, because they may not know. They may end up causing a burn injury for the baby unknowingly. So it's important that someone double checks to make sure that the water temperature is okay. So at this point, I just want to talk about what to do when a burn injury actually does happen. Because yes, we can say, oh, prevention is better and everything, but we cannot help it. It will still happen one way or another, but we just don't want it to be so frequent. So when it does happen, what do we do? Well, in this environment, we have seen that people have done a lot. Studies have shown that up to half of the people who experience burn injuries would have applied one substance or the other, before coming to the hospital. So there are various substances that we have identified. One is application of raw eggs. They just break raw eggs immediately after a burn injury, break raw eggs and apply to the wound. Some people use a cornmeal paste, which is a local pap. Some people use a Gentian violet, that's GV, that bluish substance that people apply to the wound.
Okay.
Some people apply cassava paste, engine oil, kerosene, palm oil, toothpaste, honey, and all sorts of things. So I know that it's human nature to want to do something when something, or to want to do something when an injury happens. But it's not in all cases that this is beneficial. In fact, a lot of them are harmful and may cause further damage to the skin, and may predispose that injury to infection, which might further worsen the condition of the patient. So it's recommended that we do not apply any of such agents. So what do we want as healthcare practitioners? What do you want you to do before you come to us in the hospital? So the first thing we want you to do is to remove the patient from the source of burns. For instance, a patient has just had a scald injury, spillage of hot fluid or hot soup on the body. Remove the clothing immediately. Then take the patient to probably a bathroom and apply room temperature water, preferably tap water, to the affected area continuously for 10 to 20 minutes. So this will serve the purpose of returning the skin to the normal temperature and to cool the skin, to stop the burn process, and to prevent the progression of the injury. Because the longer that heat is maintained, the more the tissue damage, the more the skin damage. So we want to stop that process by applying room temperature water for 10 to 20 minutes. So after you have done this, then you, if it's a small area that is affected, you can wrap with a cling film or something, just protect the area, apply the cling film, and go to the hospital immediately. You should get the patient to the hospital within 30 minutes. Or if it's an extensive area that is involved, you can just wrap the patient with a blanket and transport to the hospital within 30 minutes. If you cannot get to the hospital within 30 minutes, make sure that the patient is taking something by mouth, is taking fluid, because the more time you waste, the more fluid loss through the burn wound, and the patient can go into dehydration, and some other complications that can occur. So it's important that we do that. We don't want you applying anything. Don't, just water. Cool the affected area.
No egg, no jelly, whatever, petroleum jelly nothing.
No matter how minor you think it is, just come to the hospital. Let us be the ones to tell you that, oh, this one is a minor injury, and we'll manage appropriately the way it's supposed to be managed.
And I even think, from what you've said now, doctor, I even think that this is even the most economical. All you just need is water.
That's it.
You're not spending money.
Exactly.
Egg. If I hear that, how much is egg? No,
egg
don't
is now
do
very
that.
expensive.
Don't do that. The cost of egg now in the market, one egg, and you want to now break it. Precious egg. Water. Omi. Doctor, we are with you, please.
So when they come to the hospital, we manage according to the severity. Some patients will only require wound dressing and some antibiotics. But some patients, if it's severe enough, like the classification that I mentioned earlier, if most of the skin is damaged or all of the skin is damaged, in such instances the patient might require surgery. So which might involve removal of the the burnt skin and replacing it with a new fresh new skin, still from the patient's body. So that's about it.
Wow, this is an eye-opener. This is indeed a school where you learn, and the traditional knowledge, which is the way of doing things that most of us thought we were doing it right. I think this information coming from a medical practitioner today has just made us understand that we have been applying the wrong thing all the while, especially when it comes to using some of those traditional knowledge that we know to help sustain, or to reduce the pain. Instead, we are harming the body the more. And in fact, if I were you, I would sit back, because we still have a whole lot to talk about for the next few minutes. All right, we still have a whole lot to talk about. There was something you said you were going to go back to in the course of your, talking to us. Said we're going to go back. I'm trying to wrap my head on it now to see if I can remember, but I just can't now.
When I mentioned the risk factors,
yes,
about the socio-economical factors,
okay,
yes, and I said I was going to go. So in patients who live in rural communities who are not really privileged, you realize that they are the ones who do most of the things that we have highlighted, things that we have said should be avoided. They are the ones who still cook with firewood. They are the ones who cook with kerosene stoves. And most of the time, they don't even have a designated area in their homes that can be called kitchen. A lot of them cook right inside their rooms or in the corridor, in the passage, in this face me, I face you apartment.
Yeah.
So when you don't have the right environment, the risk becomes higher. So imagine a child is playing along the corridor and you're cooking right there. The child can easily find his way to the stove and play with whatever you have put on fire, and that can result in scald injury to the patient. And this same group of people, they don't have a designated play area for the child. There's just the room, the passage, and maybe the front yard. They don't have space to play with. So the child will most of the time play around the cooking area, and there's really nothing that can be done about it because they don't have space. One, the place is overcrowded, and then there's nothing they can do about it. So the socioeconomic status of the patient also has a major factor to play in the risk of suffering from scald injury.
So, but according to records now on ground, which range of children suffer scald burns the more, or scald injury?
Scald injury. So, mostly children, once they start crawling, because once they become mobile, there is no stopping them. They just want to explore their environment.
True.
So anything from 9 months up to the age of 3 years. So anytime from the stage where they start crawling to 3 years when they are toddlers and they are still exploring, that is the most critical part of the development of the child. So they want to explore, they want to see what's happening everywhere. So this is the stage that they have the highest risk. And most of the patients that come with scald injury to the hospital, they are usually within this age bracket.
All right, thank you very much, doctor. Now, can you tell us the kind of treatments? I know you've talked about preventive measures, and then you perhaps just just pass over it on the surface about the treatments, especially with the kind of degree of burns. Or I'm still using like a layman, I understand, but I'll try.
Yes, that's fine.
But then when it comes to the kind of treatments, please take us through it, and if possible, use the names that we will need to hear and know, so that we too can be informed and speak about it to people who are not getting this right now. Because as we do know, a lot of homes or houses where, as you said, they do their cooking on the floor using the firewood and the likes, may not be privy to have this information. But for those who are hearing right now and who can be able to pass it across to them, that's the essence we are doing this. And thank God you're here, and we know you're gonna keep coming to sensitize a lot of persons on several things. So with regards to those treatments, all right, please take us through it.
Okay, so this treatment is based on the severity of injury. So we have classified our treatment into operative and non-operative. So the non-operative is the one that will just apply a wound care techniques to take care of the wound to make sure that it heals. So the first category, which is the first degree burns, usually does not have any wound anyway. It's just redness of the skin, which will settle in a matter of 6 days. The skin will go back to the normal color. Okay. But the second degree is the one where the patient has a lot of blisters, that have water inside, and usually very painful. For that category, all the patient needs is wound care, and there is a particular way that wound care must be done. I know a lot of people, when they have that kind of injury, they rather stay at home, they apply all sorts of things, they dress it open. Studies have shown that wounds do not heal properly if you leave them open. So we have a special kind of closed dressing that we apply, and we expect such wounds to heal within 2 weeks. We give them a time frame of 2 weeks. Most of the time they heal. For the third category, which is a third degree burns, is a little bit more severe than second degree burns because it's deeper. It's involving more layers of the skin, but not all the layers of the skin now. So for this kind of injury, it takes longer because more of the skin is damaged. It takes up to 3 to 6 weeks for such a wound to heal. So in some situations, we still offer them non-operative managements like wound care. We prevent infection. We give them things that can make their wounds heal on time. But usually in our practice, anything any wound that has not healed after 3 weeks of sustaining the injury, we like to offer those patients surgery. Because it's not as if the wound will not heal eventually, but the wounds are likely to heal with complication once they have taken longer than 3 weeks to heal. It has this, once they go beyond 3 weeks, when they eventually heal, they heal with some unfavorable scars. They are not cosmetically pleasing to the patient. You see some burn patients with different colors of skin over the burn area. You see some areas that are very fair, some areas that are very dark. So this is as a result of wounds that this occurred as a result of a prolonged healing process. We want to prevent that by going in to replace the skin after 3 weeks of sustaining the burn injury. Another reason why we must intervene on time, we should not allow our wounds to go on healing for a long time, is the risk of contractures. I'm sure you must have seen patients with deformity of some parts of the body as a result of burn injury. Like the hand is not, if you are not able to stretch the hand fully, the armpit is plastered to the side of the body, or the neck, the chin can be plastered to the chest. So this all happened because the wounds were not taken care of properly when the wound injury happens. So this is why we say still come to the hospital so that we can evaluate. We can tell you the ones that would not need surgery as different from the ones that will need surgery. If you stay at home treating a wound that is supposed to be operated surgically, the wound might heal, but you will eventually come back to the hospital to have correction of those deformities that could have been prevented. So it's important that people come to the hospital. Please don't self-medicate when it comes to burn injury. Always come to the hospital. Let us evaluate and tell you how exactly the wound needs to be treated.
Sincerely speaking, I was saying in my mind, thank you, doctor, for mentioning that. When you made mention of second-degree burn and you said some of them will result to swollen surface of the flesh.
Yes.
You know, to be honest, I don't know. Everything keeps saying it's like I've passed through it. When I use cutlasses, okay, remember growing up in our time, they would ask us to cut grass and all of that back in school or maybe where we live. I just noticed I have blisters on one part of my finger like that. And you know what I would just do, doctor? I would just tell myself, this is a small thing now, I know how to do. I'm going to carry one sharp object, you can, water will come out, that's all. But I'm happy you're saying it now. The water may be out, that surface will look okay like that, but it is not going to be like you are guaranteed complete healing. And I noticed one thing, over time it reoccurs. Over time it swells again. I didn't touch anything, but it just swells again. So I'm happy you're saying this now. And you know, when you said non-operative and operative, to our mind, the first thing that comes to our mind is operation. With operation is that somebody is going to be lying down somewhere and they'll be cutting this part and cutting that part and doing all of that. I'm happy you clarified it by saying yes, to some extent some would need surgery.
Yes.
Especially to a lot of patients or people who have some injuries, especially when it comes to the scar injury. Those particular injuries that would need surgery, you don't do it. You just carry yourself home. Just carry yourself home. Okay, it's 41 minutes, which is 19 to 12, and it means that at this juncture we'll entertain your calls, we'll entertain your message. Should you have a question, please do feel free to call us on 0904 081 1061. There's also 0904 082 1061. Dr. Khadijat Aliyu, is kind enough, all right, to give us all the necessary information or answer whatever questions that we think we have, especially with what we are talking, liquid burns. The one we be saying now, water, sometimes hot water, hot food, sometimes fire, anything that has to, relate with your skin being affected, which is the largest, sensitive organ of the body. So welcome on board as we have that conversation. The number again is 0904 081 1061 and 0904 082 1061. So doctor, let's come back to some things that you think you haven't told us that we need to know, because I'm pretty sure your head might just be like, oh, okay, I didn't talk about this one, so perhaps it just came in now. Please share with us the particular thing you haven't told us that we need to know about.
Okay, well, since this is a burn awareness campaign, our theme is scald injury, but I may as well talk about other causes of burns, particularly flame injury. There's one particular thing that results in flame injury in our kitchen. It's a bad practice that a lot of people do. It is the use of camp gas, the LPG gas. I don't know if you know the kind of cylinders that has a burner on top of it. Yes, people use it in the homes.
Okay.
This kind of burners are not meant to be used at home at all. That's why they call it camp gas. They are used for camping. They're used outdoors because it has a high risk.
The 3 kg
Exactly.
and the 5 kg.
The ones that come with a burner on
With the
top of
burner,
it. Yes.
okay.
That type of gas cylinder should never be used in the home, in the kitchen. They are used outdoors if you must use them at all. Because there's high chance of once there's an explosion, it's going to result in a lot of injury, as different from if it happened outside. The risk is much less when it happens outside. So if you are going to use it, if you use gas to cook in the house, make sure that it's piped outside and the cylinder is kept outside the house. Please do not put a cylinder inside your kitchen. Anything can happen. There can be faulty valve, there can be leakage of the pipes that can just result in explosion one day. So it's important to avoid having the gas cylinder inside the house. So that's one thing I just wanted to talk about.
Very important, very important. And the truth is that a lot of homes are guilty of this that you just mentioned now. All right, let's not forget that we are talking health issues here. And as I said, you can be a part of the conversation. Questions, contributions, and do that on 0904-081-1061. And you can also drop a WhatsApp message on 0904-082-1061 if you so wish to bring it in form of you know, a voice note, and we'll do well to play it here. Now, Doctor, a lot of our listeners are indigenous people from the Yoruba speaking side.
Yes.
So I don't know if we can entertain questions. Should any of them have questions to ask in Yoruba, so that you can marshal it for them? Because I'm pretty sure they might be wondering, okay, can we do the language thing so that I can get answers to my question?
I think I can try.
Okay, fine. So that's good. Thank you very much. Our doctor has just said it now. We have a leeway. If you want to ask a question in our indigenous language, please do come around. Come on board. Ask that question using your language, and our Dr. Khadijat Aliyu will answer to your question or whatever it is that you have to ask. Don't forget, we're talking. Yes, please. Your name and where you're calling from.
My name is Friday. Calling from Ibadan.
Okay, Friday. Friday, do you wish to speak in English or you want to speak in our language?
No problem. I'll go with the one I'm speaking right now.
Okay, go ahead, please.
I want to ask, though I came late to the program, so I don't know, maybe she has explained what I'm about to ask. When one hot water is poured on someone, what's the best thing to put immediately? Because I know that some people, they prefer, maybe they should not touch it, maybe they should pour honey on it. So I don't know, the best thing to do after when hot water is poured on someone, what's the best thing to do?
All right.
What about
All right, Adibambo is very much available. Pretty soon you'll be hearing his voice. Thank you very much. But your question has been taken Friday, and it will be over to our doctor.
Okay. Thank you very much for that question. Although we had mentioned this earlier.
Sure.
So I said that people apply a lot of things to their born wounds. Like we have mentioned, honey, people apply raw eggs, they apply kerosene, they apply GV, and all sorts of things. All these things are not beneficial to the wound, and it's highly discouraged that you apply anything like that. So what is recommended is that you cool the affected area with tap water at room temperature for 10 to 20 minutes. Continue running the water on the affected area for 10 to 20 minutes. This is to return the temperature of the skin to normal, so that the burn process will stop, to prevent further damage to the skin. Then cover the affected area with, if you have cling film at home, you can cover it, or just wrap with a towel and transport the patient to the hospital within 30 minutes of injury. So that's all that we require. We ask you, just apply room temperature water for 10 to 20 minutes. Thank you.
All right, thank you. Friday, I hope you got that. Just apply room temperature water for 10-20 minutes in cases where hot water poured anyone. It could be a baby, it could be an adult. Make sure you use room temperature water, okay, for 10 to 20 minutes. It's even safer that way, instead of you using your precious honey, precious egg.
Precious egg.
Come on. When I heard that, a lot of us have fallen victim to that, or rather we have made that mistake of using precious egg. Don't do that now, please. Don't do that. Don't do that. Even the fowl that laid the egg will come and protest. Why are you not? So, doctor, as you were, I'm happy you went to the area of, okay, flames. Now, what about in a situation where it's gadget explosion, for example, like phone?
Okay.
And we know when that explodes, it's definitely going to burn any part of the body that it is directly having contact with at that point in time.
Okay.
Yes, that's because we have had cases of people handling their phones, making call, and from nowhere, it explodes.
Okay.
And that automatically is a burn.
Yes.
So how do we treat that as well?
So-
Should we use the same process, for example, of going into the bathroom, or there's a different approach to handling that?
Okay. For most burn injuries, except chemical burns,
Okay.
what is recommended is you apply cold water 10 to 20 minutes, irrespective of the cause, except chemical burns. Because chemical burns, in some case, some type of chemicals, if you apply water, is going to initiate a chemical reaction and result in formation of another complex chemical that results into another round of burn injuries. So we don't usually advise that you apply water to chemical burns. Just bring the patient to the hospital. Sometimes you have to remove the chemical first. But any form of flame injury, thermal injury, hot water, anything, please apply cool water for 10 to 20 minutes. Because the first thing is that you want to cool the temperature of the skin to normal temperature, because that will stop the burn process. Your first duty as a bystander or as affected is to stop that burn process. If the patient was putting on clothing, the clothing could be on fire. So the first thing is to get the patient out of that clothes and cool the body temperature, cool the body. So that is it. For all forms of burn injury, please use cold water, except chemical burns.
Thank you so much for that clarity, doctor. Because I'm pretty sure it might be an issue that has been jostling in the minds of some persons. Okay, if it happens to be this, and just as our doctor has said, for all forms of burns except chemical, apply water. All forms except chemical.
Then let me
please.
quickly add that for electrical burns,
Okay.
yes. Somebody on the line?
Yeah, we just lost that, but I'm pretty sure the person can call back.
Okay,
So
for
do call back, okay?
For electrical burns, we are talking about conductivity and all that. You must remove the person from the site of injury first before you apply water, because you must guarantee your own safety first. Because while trying to put water on the patient, you can get electrocuted too. So make sure that the patient has been removed from the source of the injury, has been disconnected from the electricity before you apply
Let's
water.
take this. Hello, good morning.
Morning, sir.
Yes, how are you doing today, sir?
I'm calling from the Road.
Ijede Road. Your name, please.
Yes, about
All right, please. Your question, your contribution, shoot.
this cylinder that my sister is talking about is one that I'm using. How can we defend ourselves from it? That's just what I want to know. Thank you, sir.
All right, thank you. I hope you got the question.
Yes, I
Please.
assume that he's talking about the camp gas I mentioned earlier that should not be used indoors. Sir, please, you have to you have to discard that camp gas and get this tabletop gas cooker with, I think it has sometimes has up to 4 burners, and have your gas piped to a cylinder outside your house. Please, it's very important, because you never know when burn injury can happen. It happens unexpectedly. You might not know that there's a leakage somewhere. It just explodes. So please, it's important. If that's what you are using now, please, you have to discard it and get the proper tabletop gas cooker, which is piped outside your house.
Okay, so doctor, am I permitted to say this, that for those of you who might be saying, but I do not have space in where I live, it's not my own house, it's a rented apartment. Am I permitted to say that the same way you check your phones to know if alert has entered, especially when you are expecting alert, you are always checking your phone to know if alert is entered. You must also develop that attitude of always checking out your pipes, checking your cylinder. Pay absolute and thorough attention to it to be sure that yes, you are security conscious, you are safety conscious.
Absolutely.
Am I coming to say that?
Absolutely.
All right. So for those of us who are yes, we are many. Those of us who don't have space in our house, please, I don't know how security conscious or safety conscious you are, but for the purpose of safety, for the purpose of the story of I know, you know, or stories that touch the heart, you need to make sure that you check these things. These are things you use on regular basis, so check it very well and be rest assured that it is safe for you. Dr. Khadijat Aliu, a plastic surgeon from the General Hospital Ikorodu. I want to say thank you very much for this wonderful session that you just had with us.
Thank you so much for having me.
And we hope forward to seeing you more before the year runs out, so that we make me want to say compliment of the season.
Thank you. I wish you the same.
All right. So I want to say thank you very much to everyone too listening and everyone that called in to ask a question. You may not be, or you might not have asked your question, but I'm pretty sure that this has been a thorough session and you have been well informed. Please, let's not take any of this information coming from IKD or coming from this particular program with levity. In other words, you sweep it under the carpet and you like forget it. Like some of us will say, back there, you know, they happen. My father did it, my grandfather did it, I will do it. Look, accident doesn't show. Burns like this doesn't tell. They don't announce their arrival. And we don't pray it happens to anybody. But as they say, prevention is better than cure. Until we come your way next week again, stay safe, stay healthy. Health issues will be coming. More programs are coming your way. By 12, you're going to be hearing some wonderful songs. 1 p.m. is going to be the World News, both in Yoruba and in English. And I will be back 4 p.m. We'll be taking it up from there with other programs. My name is Victor Achibong, and it's always a wonderful, beautiful time being here with all of you. Remain blessed.